Bill Gates' TB vaccine. Is Indonesia a guinea pig? Indonesia is once again in the world spotlight, this time related to the latest TB vaccine trial. Is this really a humanitarian breakthrough, or is it a global conspiracy scenario that we need to be aware of? Let's dissect it together. Indonesia faces a very serious TB problem. More than 1 million active cases and hundreds of thousands of deaths every year. TB is a real threat lurking behind the scenes, even more dangerous than we imagine. This disease not only attacks the physical, but also destroys the family economy and the future of the nation. We must act quickly and appropriately to overcome this crisis. Do not let TB continue to claim lives and hinder Indonesia's progress. The M72AS-Rho-1E vaccine developed by GSK and the Gates Foundation is being touted as a solution. Claims of around 50% effectiveness in previous clinical trials are certainly encouraging. But can we just believe it? We must remember, there is no magic bullet in the world of health. This vaccine may be promising, but we need to look deeper into the potential risks and side effects. Don't let hope turn into regret later. The decision to make Indonesia the location for the third phase of the trial raises big questions. Why not a developed country with more advanced health facilities? Is there a hidden agenda behind this? There is a suspicion that Indonesia is only being used as a guinea pig by global interests. We must demand full transparency and accountability from all parties involved. Do not let the health of the Indonesian people be sacrificed for the interests of a handful of people. The government claims that the trial is a step forward in health diplomacy. The health minister asserted that all procedures were in accordance with WHO standards and that participants were involved voluntarily. But are these claims entirely true? We must be critical of the narrative built by the government. The involvement of foreign foundations in national health policy raises concerns about independence and sovereignty. We must not become too dependent on foreign aid and lose control of our own destiny. The Minister of Health also promised that the vaccine will be produced domestically through cooperation with biopharma. This is certainly good news if it actually happens. However, we must remain vigilant against political promises that are often not kept. We must ensure that the transfer of technology and knowledge actually occurs. Indonesia must not become just a market for foreign products and not have the ability to produce its own vaccines. Independence in the health sector is the key to protecting the nation. History records many humanitarian interventions that have become experimental fields for developing countries. We must learn from past experiences and not repeat the same mistakes. Don't let Indonesia be the next victim. We must remember the controversial cases in the past, where untested drugs and vaccines were given to the public without adequate informed consent. We must ensure that patients' rights are protected and no one is exploited. As a society, we must be smart in filtering information. Do not easily believe the news circulating without verifying it. Look for credible and independent sources of information. Health experts, academics, social activists, and governments must come together to provide accurate and transparent information to the public. Open and honest public discussion is key to building trust and preventing disinformation. Bill Gates' visit, the TB vaccine, and Indonesia's role in the global health project are all part of a larger drama. We must ask, who is in control, who benefits, and who is harmed? We must be aware of the hidden agenda behind global health aid. Do not let economic and political interests trump public health interests. Sovereignty and independence are non-negotiable. The decision is yours. Stay vigilant, think critically, and never stop asking questions. Don't let yourself fall victim to a global health conspiracy. Protect yourself, your family, and your nation. Write your thoughts in the comments column. Is this a golden opportunity or a global game that we should be wary of? Share this video with your friends and family so that they too are alert and think critically. Together, we can protect our country from the threat of global health conspiracy.